A very good morning. I'm Dr. Abhirami from Faculty of Dentistry. Would like to welcome everyone to MAHSA International Dental Conference MiDENT 2022 Team Dental Education Preclinical and Clinical Teaching and Assessment. Here, I would like to invite Dr. Afaf Al Haddad, a senior lecturer in conservative dentistry, to present the uh, keynote lecture 1 introduction.
Bismillahirrahmanirrahim. Assalamu alaikum and a very good morning to all of the respected audience. Once more, welcome to MAHSA International Dental Conference MiDENT 2022. Before we start the introduction to our speaker, I would like to humbly request to mute your microphone, and if you have any question, please share it with us at the Q&A session at the end. The first speaker for the keynote lecture number 1 is Prof. Dr. Chun Hong Chu. Dr. Chu is a professor and associate dean of the Faculty of Dentistry, the University of Hong Kong. He is the president of the Society of Preventive Dentistry of Hong Kong, the president of the Asia Academy of Preventive Dentistry, a member of the FDI World Dental Federation Public Health Committee, the Vice President of the Oceanian Federation of Conservative Dentistry, and the immediate past President of the Southeast Asian Association for Dental Education. Dr. Chu was conferred with a BDS, BDS, MDS, and PhD from HKU, which was ranked second by the QS World Ranking 2022 by subject. He is a Master of the Academy of General Dentistry, AGD, and received the prestigious AGD Lifelong Learning and Serving Recognition Award. Dr. Chu was the dentist in charge of the HKU Health Service. He is a fellow of the Hong Kong College of Dental Surgeons, a dental fellow of the Hong Kong Academy of Medicine, and registered dental specialist in family dentistry in Hong Kong. Through overseas examinations, Dr. Chu became a fellow of the Royal Asians College of Dental Surgeons, RACDS, in Sydney, a dental fellow of Royal College of Surgeons, RCSED, in Edinburgh, and a diplomate of the American Board of General Dentistry in Chicago. He was elected as a fellow of the Faculty of Dental Trainees, RCSED, for his eminence in teaching. Fellow of the Academy of Dental Materials for his excellence in research, and Fellow of the International College of Dentists for his dedication in community services. Dr. Chu published extensively with a Scopus H Index of 40. He is a section chief editor of Frontiers in Oral Health and Dentistry Journal. He is an editor of International Dental Journal, JDR Clinical Translation Research, BMC Oral Health, and International Journal of Environmental Research and Public Health. As the principal investigator, Dr. Chu received more than 9 million US dollar grants. He teaches restorative dentistry for dental students and supervises research for PhD students and postdoctoral fellows. Dr. Chu is a dental examiner of the RCSED and a member of a specialist board in dental public health of the RACDS. Today, Prof. Dr. Chu will present for us a topic, global citizenship in dentistry. Without further ado, let's all welcome Prof. Dr. Chon Hong Chu. The stage is yours.
Okay. Good morning, Dr. Alpha. Can you see
Good
me?
morning.
Thank you for the nice introduction. And also, it's an honor for me to join the MAHSA University for this conference in dental education. My first encounter to the MAHSA University back to some years ago, when MAHSA is one of the very first university to establish family dentistry for total patient care. I applaud the staff for the endeavor to do dentistry in a comprehensive perspective to provide comprehensive dental care for family dentistry. So I totally agree with the spirit. Treating dental care is on a patient level, not on a tooth level. So the development of the family dentistry in MAHSA University is a great success. So I'm happy to join the MAHSA University in the development. Okay, so back to the topic. I really want to
Sorry, it seems that we lost our keynote speaker. Hang on with us, please.
hello.
Yes, Prof, we can hear you.
I'm sorry. So I'm sorry for the. So can you see the slide now?
Uh, Slide not yet, but we can hear you and we can see you.
I'm sorry for the technical error. Let me see whether it's connecting well. Can you see the slide? Share. Can you see my PowerPoint? Excuse me? No.
Not yet. Not yet.
Okay.
Our IT team will guide you, Prof. They are in contact with you now. We would like to apologize for this inconvenience. Actually, the weather here is raining heavily today. So I don't know it's from our side or from Prof side.
Okay. Let me see. Let me see. Hi. Is that okay now?
Personally, I cannot see anything.
Wait a minute. How about now? Can you see it now?
Yes, yes, Prof.
Yes, PowerPoint, right?
Yes.
Yeah. Okay, I'm sorry for the interruption. So today my topic is internationalization at home. So we understand the COVID actually is affecting us. However, it won't stop our exchange in knowledge and also teaching and learning. So today I'm going to share with you how we can continue our dental education at home. Okay, and I mean at home is not only at our university, but also at our home. So it's the global citizenship in dentistry. First, I would like to talk about Hong Kong. So you see the fireworks, right? So a beautiful fireworks that was actually on the New Year Eve of 2021. Okay, you can see the nice fireworks in Hong Kong. So please come to Hong Kong. We have fireworks on the National Day when we return Hong Kong. We return to Hong Kong, and also there are several days we have fantastic fireworks that and the Victoria Harbour. So that will attract a lot of tourists. So 3 or 4 times we have fireworks in the evening to show you. In case you do not come on the right time, on the right day, we still have fireworks every night in Disneyland. So this is the Disneyland firework. If you go to Disneyland, you can enjoy the beautiful fireworks there. Or if you don't want to go to Disneyland, we still to have a symphony of light. Okay, you have all the laser appear in the Victoria Harbour every night at 8 o'clock. So if you show along the seashore, you can see the beautiful scenery of this laser light, a symphony of night in the evening every night in Hong Kong. So we welcome you to join us. More introduction about Hong Kong. Hong Kong basically is an area about 2,700 square kilometer, or to be easy to remember, is about 1,000 square miles. So with a population of 7.3 million, so most people are staying in the Hong Kong Island and Kowloon, and we have a lot of land that is belong to national park or the park in New Territory. You can see most people are staying in a small area in Kowloon and Hong Kong. And that's why in Hong Kong, you see we are very crowded. Okay, we have shipbuilding very close to one another. You can see very crowded places in Hong Kong Island. So more to talk about Hong Kong. Hong Kong, one of the famous hotel, we have nice hotel to welcome you. Peninsula Hotel, which is opened in 1928, is the first hotel now stand the oldest hotel in Hong Kong. And you can see a very nice place for you to enjoy. It's a 6-star hotel, it's world famous. So you must go there to take a walk. Okay, even though you don't want to stay there, it's a very nice hotel that you should visit. In particular, at the afternoon tea is world famous. You can also go to different parks. You can see on the upper left is the Ocean Park, okay, which is one of the best park in the world. Okay, you see all the fishes in the ocean, and on the bottom you can see Disneyland, and right side you can see you can go to the peak, take the tram to see the beautiful scenery of Victoria Harbour on daytime or at nighttime. And also you can see the colonial building, okay, a lot of colonial building that is Hong Kong, is a heritage to see the development of Hong Kong there. But apart from that, I would say Hong Kong, there's a lot to explore. As I mentioned, more than 50% of the land is national park. So you can see beautiful scenery in the New Territory. So if you like hiking, then it's one of the good places that you can take a look. And also we have the tram. Okay, this is a very a traditional tram, a very efficient kind of transport, and it's inexpensive. And then on the lower right side, you can see the wetland park. It's a public park that you can visit, and you can see the junk in the Victoria Harbour. And also, there are a lot of museum, art museum, the government service museum, history museum, 3D museum, special interest museum, science museum, and they are open, okay, at a very low, you can buy a ticket at an inexpensive ticket, low cost ticket, or in some day they are free that you can join. So in Hong Kong is not only Disneyland, but there are a lot of museums that you can visit. So I would say you can spend 1 to 2 weeks in Hong Kong with lots of fun and enjoyment here. Then I want to introduce the dental school. So this is the dental school that was founded in 1981. And this year we are celebrating the 40th anniversary. And this is the dental hospital, okay, that I would say this is the #1 hospital in Hong Kong. Okay, always in the past 40 years, we are the #1 dental school in Hong Kong. Why? Because we are the only dental school in Hong Kong, and that's why we have been #1 dental school in the past 40 years. We are also fortunate that we are #2 in the world ranking in dental subjects. Now let's talk about the Hong Kong U Vision, our university. So our vision is, in simple term, is called 3I per eye. What is 3 eyes per eye? Is first, our dental education, research, and knowledge exchange must be international and must be internationalization. So that means we look for international collaboration and exchange. And the second is interdisciplinary. So we are not looking at dentistry, we are looking at dentistry with social science to see how we can train a better dentist. So-called, for example, we are looking, the students currently are doing a project to develop what is in the perspective of good dentist or successful dentist. So we work with social sciences, we work with medicine for collaboration in different topics of, in particular, we are doing very well in the, surgery and cancer, and also working with speech and science on talking about dentistry and speech. So we look for interdisciplinary research and teaching, and also we look for innovation. So the 3I is internationalization, interdisciplinary, and innovation. So at the end, the 3I plus I, the last I is the impact. So all these strategy of internationalization, interdisciplinary strategy in innovation, we hope to create an impact to the society and to the development. So we call this vision is Hong Kong U is 3I plus I. And that is to create an impact. Now we want to focus on internationalization. Why there's a need of internationalization? First, it's important and essential to develop global citizenship in intercultural communication. I mean, dental graduates nowadays are moving from country to country to develop their continual professional development and also learning. So even in Hong Kong U, we have quite a number of Malaysia graduates coming to Hong Kong to further their study. And at the same time, Hong Kong U students actually are also moving to Singapore and sometimes to other countries. I'm not sure whether they move to, and as far as I know, there are postgraduate students moving back to Malaysia for dental practice. And also we understand students, the graduates are moving from country to country for dental education and dental practices. So it is important to develop a global citizenship and also for them to understand the cultural need between different places for better communication. And the second is to serve the client for different countries and cultural background. Even, the dentists are working locally in their own country, we understand now the client, the patient, are not necessarily from a single country. They are maybe coming from different country with different culture perspective and also different habits. So it is important for our graduate to be trained has an internationalization mindset so that they can serve the client better. And of course, it is also very important nowadays to know the different practices and the school of thoughts, in particular in their own region. I would say over the past years, working and joining the dental meeting of the dental education, I found there are sometimes quite significant differences in dental education in the region. For example, in China, they are still adopting the Russian style of dental education. So dentistry is a specialty of stomatology, which is a branch of medicine, whereas in Japan, basically they have a DDS training. In Malaysia and Hong Kong, we have the undergraduate training following the British system. And this system can be quite different. So it is important for students and even also for the staff to understand the different practices and school of thought in our region. And of course, once we understand one another, that will facilitate communication between different people from different countries and also from different dental schools. So how we can implement this internationalization? We develop a platform we call Global Citizenship in Dentistry to allow our students and staff to enter the site and to communicate and share with one another. So why do we not use Facebook? Because it's open. We want a more professional and more safe, is more confidential sharing among the professional in the website. So we developed this platform. Yes, it is similar to Facebook, but on the other hand, actually the sharing is basically, it can be more professional and can be more confidential within the community. So this is a website that we developed and allow our participants to log in with a password to share their ideas and their thoughts and sometimes pictures between them to learn from one another. And they are not supposed to share all this information and photo outside this platform. So we call this platform is a Global Citizenship in Dentistry Learning. Okay, so this is the website. You can see the gdc.hku.hk. So why we need global citizenship in dentistry? Global citizenship can build, these are some merits. First is building professional networks. So allow people from different countries to mingle together and share their information and best practices, in their own country. And also that allow intercultural communication. And people from different places, they have different background. And I understand Malaysia is a very strong Muslim background, whereas in Philippines, they are more Catholics. So I would say sharing the best practice between different countries is good for us to understand the intercultural differences and similarity between different university and even country. Dental education in a global aspect also allow our graduate or even our staff to gain confidence in their own school education, and they can see the strength, okay, and also the limitation of their own dental education, and this allow to open their eyes to see the differences and also the merits of the other dental school. And also, the student and even staff joining the program can become more aware of the different approaches to the same problem, as well as the rationale behind the approaches. I will see tackling problems, okay, the same dental problem from different places or from different university may not be necessarily the same. There are other advantages. Of course, by sharing this platform, the discussion is emphasized, is focused on evidence-based dentistry, so that we will use the student works that to give them the reflection of their own operative procedure, okay, and also through the platform of sharing the works among the students, they can recognize and appreciate the differences in dental treatment across the country. Some countries favor the use of composite resin. That's definitely right because of the now we are not using less and less dental amalgam. But you will say, actually, we have one dental school still consider amalgam with one of the most reliable and also low cost and also a moisture tolerant type of dental restoration that should be used on patients, particular for those who cannot afford the expensive dental care. So it is good to understand and appreciate the differences in dental school. And also, it doesn't matter, there's no right or wrong to use what type of material. It depends on the situation. But we also want to train the dentist or the student, okay, able to defend the decision and defend the conclusion in an evidence-based format. Global citizenship in dentistry also allow them to communicate in a professional way, in a professional manner. This is a start for them to learn how to communicate in a professional manner. And also, by sharing the work in a website, they can learn how to make comments, okay, in a supportive and professional manner, and try to enhance one another knowledge and skill in the operative dentistry. Global citizenship in dentistry is also a way of e-learning. E-learning is becoming more important, okay, and from this aspect, the global citizenship in dentistry allows students to prepare and upload an assignment with clinical photos that they can share the work, okay, and subsequently they will participate in a closed box, which is limited to themselves. It's not like a Facebook, they're open to public. This closed box allow to share the information in a safe and confidential manner. So I'm going to talk about what is this project. Okay, for this project, actually the outcome, the student should know what are the outcome, what are the things that they can learn. At the end of this program, they are supposed to learn about the practices, dental practices in other countries. And also, there's no need to travel. They don't need to go to Malaysia or somewhere to travel to learn. They can learn it on the online. And subsequently, when they understand more and more, if they really want to go for the elective study, they are more well prepared and can able to learn more when they do the elective study in other countries. So now I'm going to talk what are the things that they need to do in this project for the students. Okay, for the student, the first, they need to write an introduction letter. For each student joining this program, they need to write a letter. What is this letter for? Is to they will give themselves a photo, okay, and then to introduce to the that particular group that we assign. Okay, and that group, they have different students. Then they can a student can introduce themselves, their hobbies, where they are from. Is a general introduction talking about themselves, so that the student in the same group, okay, can understand themselves better. And then after the introduction, they need to do an assignment on an operative procedure. For this assignment, it can be composite restoration, it can be anterior composite, a posterior composite restoration, or they can use amalgam restoration. And nowadays, actually in these 2 years, they are also allowed to share their works using glass on cements. So there's more a variety. They can choose one topic to show to the groupmate how do they achieve this restoration in a step-by-step manner. I'm going to give you some ideas of the work that has been done in the for our student. This is an example for student sharing his way on doing composite restoration. You can see it's step by step and showing a slide. They can talk about what instrument they are using and how do they do tooth preparation, how they etch, and how they use the composite to build up the tooth. And then they can even have some reflection about the work. And this is they after they develop a PowerPoint, they can upload the PowerPoint into the Global Citizenship website and then share with other students. And students from other country, other university, and they can make comment and ask questions, and they share how among themselves how they do this composite restoration in a way according to the principle of the dental school. And then this is an example talking about the posterior composite. You can see there's no fixed format of style how to share, and each student can share the PowerPoint designed by themselves. But we limited to this PowerPoint to 25 slides. We don't want a student to produce 300 slides to share. So they are allowed to share 24 slides. Okay, and also we are using models because some country there is some at this stage in some country, particular the US, they have no. They are very strict about the confidentiality of the patient information. So because this project, we are sharing this PowerPoint even among the dental students. So some country, for example, the US and also some other places, they have concern about showing clinical information. That's why we are using at this stage a faculty to demonstrate the procedure that they are doing. And of course, we are still using amalgam in Hong Kong. Is facing down, okay, but students are still learning amalgam restoration. And this alpha, the student, are doing step-by-step amalgam restoration, showing how to do a mechanical cavity prep with retention and resistant form. What are the burrs that he used, and how he developed the cavity, and then the rationale behind, and what are the instruments that he is using to perform the procedure. So you can see students are presenting restoration at their own choice and upload to the platform for discussion and sharing. And then after they upload all the PowerPoint, this side you can see members, the staff, okay, from different countries. So we have staff and we have students, and they can mingle, they can share the work here. Okay, so this is the platform. They can safely share their views and also their works over this Global Citizenship website. And actually, we want to divide this student group into a small group to facilitate the communication. We never have a big group more than 10. so that the student in a small group can discuss and participate actively. Okay, and actually it's a requirement for some dental school that they even count the GPA on the discussion. This is to facilitate a more active discussion among themselves. There are a lot of benefits of this project. Okay, when we can see this project, when we after we implement it, we found that the awareness of different approaches to the same problem and the rationale behind these approaches, not only from the student but also the staff, are greatly increased through the project. Actually, I even myself, I learned a lot, okay, and noticed that there are some differences in different approach by different school of thought on, for example, the sandwich technique and the baffling of enamel, which are quite controversial when we're talking about dentistry. Also, for example, we have recently a discussion whether the calcium hydroxide is a very, very effective, I mean, antibacterial agent or mineralizing agent to promote tertiary dentine formation on deep caries lesion. So it's a very interesting study. I've been using calcium hydroxide lining on the deep cavity plaque. Then I realized some school they believe that there's not enough clinical evidence. Very interesting discussion can generate through the discussion of these projects. And also, then they allows the student to reflect on their own work. So we don't need to demonstrate our excellent work. Sometimes the students are sharing the mistake so that the other student can learn how to avoid this mistake. And actually, by learning how to do a good work and how to avoid mistake, we hope that they can be more confident when they are in the competency of dental care. So, of course, by learning through discussion and also the student also are required to make judgment, okay, in defending the decision and making conclusion for the treatment. Okay, as I mentioned, there is no right or wrong. So we want to train students to learn how to justify what they are doing on the patients or on the in future. So this is greatly benefited on both involved not only the student but also the staff in the process of learning. That will make learning not a repetitive, mundane process. It's an active learning years over years, and also that will also help the different school, to reconsider, the school of thought in procedure in the teaching, at least in this program in operative dentistry, and also the program enhance the pedagogical development on the aspect on the peer learning and professional development. And I would say this will add great value to dental education. Actually, the more we discuss, there is a more benefit on this program. So we found that this program is not only enhance the skill and understanding in operative dentistry, that also help to develop their professional identity. And also students actually understand this, they are becoming dentists when they discuss among the different schools. For example, in the United States, all the dentists and dental students basically are graduate students. They are more mature. They have a very, very serious manner on looking as a dentist. Where in Hong Kong, the dental student can be very young, maybe 18 or 19. Okay, they understand they need to be a dentist. They need to learn from the dental school, but the attitude and behavior is quite different when they communicate with the dental student, and basically they are graduate students, they did a first degree. So that will facilitate them for learning. And also, that will help the pedagogical development in the Faculty of Dentistry, not only the Hong Kong, but also to other participating schools. Actually, we also encourage students to collect their feedback. And one of the students actually is Francis Yu, a second-year student. And then they collect the student and publish the result in a peer in the Journal of Dental Education in 2021, last year. So the student actually tried to explore the achievement and the perspective, okay, also from the student, okay, from this program we call International Peer Review Setting Program, the GDC program, and he used an open-end questionnaire to explore the experience on the GDC, and then they interviewed the student, and then they found that most of the students are quite enthusiastic about to apply the knowledge and skill and critical thinking in evaluating the operative work. And actually, they also this program also this study also allowed to share the learning barriers. They understand they need to need extra time to for the program, and also help us to overcome some technical problems in this program. And of course, it is very important that we to motivate the student, because indeed there are some students they are less responsive, I would say, in a not very professional manner, not with delayed replies. And from this program, the students are trained, need to be responsible and to be professional in replying email in a proper manner and also in a polite way. So I would say this project, in conclusion, the students are welcome this project. They find that this is important for the academic exchange development. It's more important on the critical thinking. Okay. So the students are also access to the journal for the learning and education. One journal actually is the European Journal of Dental Education, and the other journal is the Journal of Dental Education, for them to understand. Actually, the teacher also benefit from it, because at least from Hong Kong, all graduate, okay, finish the professional training that as a basic dentist is almost 6 years. Okay, that means they are about 25. If they want to specialize, they need another 6 years to be a specialist. And if they want to teach, they need another 4 years to a PhD. So by the time they become a specialist and a PhD, basically is 30 in the mid-30s. And then they realize the knowledge and skill can be much improved in dental education. So I would say this program allow them to continue their learning to do how they can learn dental education in a proper way. We are now collaborating with Faculty of Education to learn how to do a better teaching. It's become an interdisciplinary project, so that to enhance the understanding and learning from the e-learning platform. So it's exciting that the Faculty of Dentistry, through this project, can work in this interdisciplinary way to develop more strategy and pedagogical method in delivering dental education in our university. So what is in future? Okay, so I would say, in particular, we never know what will be the next COVID academic that will hamper our learning in a dental school. However, we can still learn online, okay, not only from our university, but also from different universities in the world. So by doing this, students can continue working with more universities in different places. That will increase the diversity in peer learning, not only from the peers from the same university, but from the other university. That helps them to develop a network for the future development. And Of course, that is full of challenges. The student need more times, the staff need more time to develop such program, and the time zone may be different, so they need to adjust. For our program, the program we are involving in the United States, the Manchester in the UK, Hong Kong, and that can be quite challenging because of different time zone. Okay, we also have a university joining from Africa, is Mansoura from Egypt. So, and we also understand the society, the dental association, they may have different sets of professional standard. And it is interesting to learn the different standard, okay, more or less the same, but there are minor differences between different countries. And that is also important on the negotiation, on the design of on the curriculum, and also the course requirement. And sometimes the school terms are critical to scale up these projects. So in conclusion, I would say our dental education is facing opportunity as well as challenges in the future. And then staff and students needs to develop new pedagogies and strategy in dental education and try to pursue internationalization and interdisciplinary dental education and training is becoming more and more important to address the need of the demand of the society. So that is the end of my presentation, and thank you.
Thank you so much, Prof, for the inspiring talk. Actually, the topic is very interesting for me personally. And I have one question, if you allow me to. Can we consider that the current or modern Facebook pages, TikTok, Instagram group, whatever, we saw them posting their cases, it can consider of internationalism, this group?
I mean, Facebook is more open, and also the archive is by the Facebook. So we respect. The intellectual property of individual students, and even that's why everyone joining the group are supposed and agree not to share, okay, the information outside the GTC. So we respect the student, even the staff. If they want to use what the student developed, they need to have consent from the student. And basically, in principle, the intellectual property belong to student and individual staff that upload the information. That's why we believe that this platform is a more safe platform for the student to share the work.
Okay. So
So
this one to grant
we really
grant
worry that
right of the student work.
if you use the Facebook or whatever platform, then you upload the information to something outside that may be beyond your control.
Yeah.
This is more important.
Maybe the evidence says that. Yes, sorry, Prof.
This is particularly important for some country. For example, in the United States, they are very very strict. Okay, to make sure the information they share. Okay, so that's why we learn from. I would say in Asia, okay, it's more relaxed. Okay, so that's the beauty of learning the different system. For example, in the US, they are even not allowed to share a slide on the clinical photo, even the patient sign a consent, because the consent allow the student and staff to share in the university, but not outside the university. So that's why doing the program like this, I learn a lot. The privacy, okay, that is quite different from country to country.
So, Prof, from your experience, what are the most challenges or significant challenges for intercultural communication in dentistry? Is there any challenges?
Yes, definitely. There's a lot of challenges. I would say different country they can be very different. Okay, definitely the practices, the way of living, China and US are quite different in the way of thinking, in the way of sharing the information is very different. Okay, so whereas to the US, a lot of things is freedom. You can say whatever. In China, then maybe slightly different. I would say even from other country, maybe Malaysia, can be very different from uh, uh, US. So, for example, cannabis is allowed. So there's quite a lot of youngster and patient they take cannabis. So it's allowed in Amsterdam and also in some. I mean, for Malaysia, even Hong Kong, you you'll be in jail or even death penalty, right? So you will see alcohol taking, right? Taking chewing gum. So okay, so that is important for the student, dental student to understand. There are lots of differences. Okay, this aspect may also affect the practice of dental care.
Thank you so much, Prof. Actually, we have some more question. Prof. Ruzna is asking, would there be different consent to share it widely outside the university?
Oh yeah,
Would
basically
there be different consents?
yeah, we still rely on their own country. However, that's the reason why up to this stage we are still using SIM-lab Fasaco model. We would like to share clinical photos, but this is a big problem to the United States. Okay, very interesting. When I was introduced to go to the SIM-lab, you need a day training to you can't go to the sim lab and do, for example, I've been teaching the operative course as the instructor for so many years. If I go to the US, I need to be trained to learn the safety, okay, in the sim lab before I'm allowed even to do our work on the model. So I would say different places they have different consent. We will use their own country consent, okay, for student to sign to join the program. But the program basically, I would say this GDC program, the common consent is they share what they are allowed to share, okay, and then okay, this is not allowed to share outside the GTC, and that's why we need a GTC website. It's not allowed. Okay,
That
and
was
even
very
the teacher are not allowed to use the student work to teach for
really?
teaching. Yeah, it belongs to the student. The intellectual property belongs to the student, and they should not allow to quote what a student and other to outside the checkbox, the blocking. It's only contained inside, let's say, so they will feel safe.
Okay, so it's only inside that platform.
Yes.
Okay, another question. How does global citizenship differ from virtual international student mobility project?
Um. I
In terms
first I
of
would say yes, you can do the you can say is not exactly uh, different. You can say, but it's a more defined. This whole citizenship project, we emphasize in not only the sharing of the project, it's also the introduction. I mean, for the connecting, so that they can learn from the different culture and also from different diversity. This is also an important part in this project. So that's why when we start our project, we purposely choose university from different continents. So Monsora from the Egypt, and we have uh, uh, University of Health and Science from United States, Manchester from Europe, from UK. So we purposely choose university from different continents to develop this project. And also I would say our project is a more well-defined project to choose to select university from different country, and different country actually in a way that represent maybe that continent or the region for discussion. For the in terms of impact, I would say that will allow students to understand, or at least a taste from the differences and similarity of dental practices, and also the cultural environment from different continents. So students can share whatever they want to share. Okay, in the website safely, they will feel safe to share the information and discussion within the GDC website.
Okay, one more question. Will this be accepted by respective council bodies? Any comment on this? This program?
Yes, this is part of our training program. Of course, our training actually, we are persuading the dental council. We are the dental council in some way. They still allow us to require the student to work on certain number of item based to fulfill the dental council. But we are discussing the council. We will try to talk about the competency based, and also looking at the outcome as a comprehensive development. And we will consider global citizenship in dentistry is one of the elements that students should understand, because not only the student will be moving across the country, and they are serving people from a diversity of diverse background. So this is accepted, I will see, as a council, as a part of training. Of course, not everything, as a part of training for the dental development.
Prof, one more question. What year of dental student would be more suitable to participate in this global citizenship in this industry program? Like if preclinical suitable as well as a clinical?
I think yes, it depends on the objective. Okay, if you want to understand the different education system, cultural difference and similarity, I would say junior students are able to learn. For example, we have recently a very interesting topic that we are discussing. Actually, it should be start from more junior students. And what are the objectives? Of course, everyone would say one of the objectives that every new student and fresh graduate joining us want to be a good dentist and successful dentist. And how would they define it? And you will see very interestingly from country to country, the definition of successful dentist and a good dentist can vary significantly. Not, of course, not only between countries, but even in our own school. Very interesting discussion. So, the student can, I think, have a reflection what they are aiming for, what are the target, what are the objectives to achieve the goal of the career goal of becoming a good dentist and successful dentist. And that can be conducted into a more junior year. Of course, if you require more holistic treatment planning, that will be more suitable for senior years. Now we are a bit concerned, okay, when they share the clinical photos, okay. I would say for some, maybe in Asian country, we may easily share our thoughts, okay, and even some slide, okay, with patient consent. but in the United States can be quite different and difficult. So we still don't know how we can have a unanimous agreement on sharing the clinical photos. Even they don't show the faces, even only the teeth. So we have to iron out this procedure before we implement. But otherwise, I would say this platform allow very good understanding and discussion between university in different regions.
Thank you so much, Prof. We'd like to thank you for this wonderful talk and a lot of informative speech.
One
And
more thing I want to
yeah,
add.
sure.
Google and Google, Facebooks are so common, right?
Yeah, and that's what I see. I see many groups that is sharing cases.
Yeah, but I just let you know in China, you can't
Yes,
access to Google and Facebook.
you
It
cannot.
may no. So you say that's why we need to learn from one another. Okay.
I see. But I think there is another platform other than Facebook, right?
Yeah,
For
but
social
if
communication.
you can use another platform, but they may not be welcome from some Western countries. So you see, that is an
I see.
interesting discussion.
And I think this platform that is social communication, we cannot guarantee that come with the same result. What do you think?
Yeah, I can't hear, but yeah.
I'm sorry. I said sometimes in the social platform for social communication, some people may post some cases, practical or clinical cases, but we are not sure what is the evidence based behind that practice.
Yes,
We cannot
exactly.
confirm.
This is the way also we want to ask the student. They need to how they can cite the defend their cases and justification. Uh, what are the resources, material they are using to defend the case? This is a very important part in this global citizenship in dentistry learning. There are a lot of discussion, very the procedures, for example, the use of sandwich technique, okay, the phasing out of amalgam, all these generate a lot of discussion, and they need to defend the conclusion. There's sometimes people say is right or wrong, but it's from different perspective. And this is a very good, that's why this platform, the Global Citizenship in Dentistry, can be a very good platform for people to discuss, I would say.
Thank you so much. Thank you so much, Prof.
Thank you.
And by the end of this lecture, I would like to invite our Dean, Prof. Rosna, to hand over certificate and token of appreciation to the Prof. Chu.
Okay, thank you very much, Prof. Chung. That was an excellent lecture that we have learned a lot from it, and we'll definitely would like to communicate further with you in the future with regards to examples of this global citizenship and things like that. So thank you very much. Please accept our thanks and appreciation certificate and a little gift that we may just courier to you.
Thank you. Thank you so much.
Okay then.
Okay, bye-bye.
Bye.
Please, everyone, I would invite you to stay tuned for the opening ceremony in a while. I will hand over for Dr. Abirami. To start
A very good morning. I'm Dr. Abhirami from Faculty of Dentistry. Would like to invite everyone to our MAHSA International Dental Conference MiDENT 2022 team Dental Education, Preclinical and Clinical Teaching and Assessment. Let's start today's program with the thanks to the Almighty. I would like to invite Dr. Faris for Dua recital.
Let's start with Kita Al-Fatiha. بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على سيدنا محمد أشرف الأنبياء والمرسلين وعلى آله وصحبه أجمعين اللهم أنت السلام ومنك السلام وإليك يعود السلام حينا ربنا بالسلام يا سلام سلمنا أجمعين وجعلنا من عبادك الصالحين Ya Allah, Ya Rahim, praise be to God, the Lord of the world, peace and blessing be upon our Prophet Muhammad sallallahu alaihi wasallam and his companions, and for those who follow his example till the judgment day. Allahumma ya Allah, on this blessed morning, in conjunction with the MAHSA International Dental Conference MiDENT 2022, we beseech thee and grateful towards you in favor for all infinite blessing to us, your humble servant. We seek your blessing for a flawless progress of this event from the beginning till the end. We seek your guidance to take care of event that will be detrimental to the progress of this event. Ya Latif, Ya Rahman, please bless us with your tawfiq and hidayah. Please guide our university to the greatness, peace and glory and prosperity in this world and hereafter. Grant us with the valuable knowledge that will be beneficial to mankind in order to gain madatillah. Make us responsible intellectual. Make us your righteous servants that follow your commands and neglect the sinful acts. Please forgive us for our wrongdoing. ربنا عليك توكلنا وإليك أنبنا وإليك المصير. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. وصلى الله على محمد وعلى آله وصحبه وسلم والحمد لله رب العالمين. آمين.
Thank you, Dr. Faris. I would like to invite Prof. Rosna Binti Zain, Dean of Faculty of Dentistry, to give her welcome speech.
Thank you, Dr. Abhirami. Bismillahirrahmanirrahim. All our Prof. Dr. Sri Chakravarti, Director, Postgraduate Studies, Research and Innovation. Our keynote speakers, Professor Dr. Chu and Professor Nur Hayati, and all participants, other speakers, and organizing committee. Ladies and gentlemen, Assalamualaikum and Salam Sejahtera and a very good morning. It is my great pleasure to welcome you to the MAHSA International Dentistry Conference of 2022. I would like to take this opportunity to welcome all participants to this MiDENT 2022 and congratulations to all dental practitioners, educators, and researchers for being part of this conference. Our education landscape is currently changing or has changed. I think the era of conventional teaching is now transformed and moved on to the digital era. And we are faced with students of different groups as compared to in the past. Therefore, whatever's conventional teaching that we have been doing in the past need to change. And the change goes with innovation in teaching. Thus, our theme for this year is dental education, preclinical and clinical teaching and assessment. And our aim is to bring dental practitioners, educators, researchers, and other groups related to the field of dentistry to share their experiences on the advancements and development in educational sciences. I would like to thank all our speakers for actually agreeing to come on into this. And we did get a number of speakers from different, from Malaysia and different parts of Asia. And secondly, of course, I would like to thank and acknowledge the entire organizing and support team who have worked hard for endless efforts in planning and execution of this conference. Thus, I hope that this MiDENT 2022 will proceed to give good and innovative insights to all participants. So once again, welcome to you all and wish everyone a successful and fruitful conference. Salam and thank you very much.
Thank you, Prof. Rosna. I would like to invite Prof. Dr. Sri Kumar Chakravarti, Director Postgraduate Studies, Research and Innovation of MAHSA University, to give his opening speech.
Thank you so much, Dr. Abhirami, Prof. Dr. Rosna, Dean of Dentistry, MAHSA University, Prof. Dr. Kranti, Deputy Dean, Dr. Pratap, Deputy Dean, members of the organizing committee, and participants. Come for the next second version of the Mi-Dent 2022. And after the grand success of 2021, now 2022 again I can see is going to be a resonating success. And this time your theme is advances in dental education and dental practice, both preclinical and clinical. Now, when it comes to advances, my role today in my opening speech is probably to be a devil's advocate and put some thoughts in your mind so that it will help you to discuss a lot of things during the rest of the day amidst various speakers. And I talk today not as a director for research, but as a pathologist who has been teaching dental students as well. And as we have in the medical specialties about various innovations, even in dentistry, the past 10 years have been full of innovations. And will these innovations have a huge impact on dentistry, or will it be disruptive, is what we need to focus on in the next few years. And probably this may be a topic to focus on during today's workshop also. Some of the speakers are very eminent today. Now, what have innovations done for us? Can you believe it that for those who go to a dentist for 4 or 5 sessions to make a prosthesis, now you can get a 3D printed prosthesis in an hour. Or for those who cannot go to see a dentist, can get a tele-dentist consultation. Or those above 80 who have lost all your teeth, you can start growing new teeth above 80. Now, unbelievable, isn't it? Well, these are all aspects of new innovations that we have now in the world, and it's up to us to either accept it or decline it. Now, if we want to accept it, as many of our conferences have been focusing on IR 4.0, if you want to accept it, we should be ready for many people to give up their jobs. If we reject it, we are not being wise because we are not accepting technology for the best of our advantage. In all these aspects, MAHSA University has done its best in living up to, taking up to the latest technological advances in our research and in our dental practices as well. To start with, I really commend our MAHSA dental team in starting your projects on artificial intelligence. Now, world over, dentists are employing software to get insights into your clinical decision making, whether it is a simple procedure or a complex procedure, because AI uses health data. And once you analyze health data, this health data can be used to offer various diagnostic and even therapeutic recommendations, which is what we are doing with radiographs now in MAHSA University, where we are actually using artificial intelligence to analyze radiographs and interpret radiographs as well. So these are, we call these as AI-based algorithms, and it can help us all to treat various dental conditions. In terms of pathology, in terms of oral pathology specifically, now AI can be used to see the number of inflammatory cells that surround an oral cancer cell. If you have a cancer in the oral mucosa, there are inflammatory cells that surround it. You can use AI to see this, and it will help us to determine the prognosis of oral cancers as well. And also in future, Now, I am made to understand that AI can be used to detect dental decay and periodontal disease as well. So that is technology for us. Now, as much as MAHSA is into artificial intelligence, world over, people are going on into smart homes. You just go home and you say, "Hey Google, what's the weather?" Or switch on the music and Google accepts it and Google does it. So does Alexa. But now we have a smart device which is a smart toothbrush. It has a sensor in its handle, and when you brush your teeth, it accompanies to a phone app, and that app will tell you whether you're applying too much pressure or whether you're brushing properly or how better to brush. So just imagine you have another gadget inside your mouth when you brush your teeth. So advances are numerous, and now we are having augmented reality. And augmented reality is being used for students in many universities world over to teach dental students, where the students work on a mannequin and they perform procedures. And as soon as the procedure is done, they receive immediate feedback using the augmented reality in the mannequins. And this is not exactly a new technology. This was used even a few years ago for something as simple as when I bought this spectacles from a company called Lenskart, which is an online company. All I had to do was key in the power and choose the lens, and the company uses my face using my laptop camera to show me how I look with different glasses over a 360-degree view. And the same thing is being now done now for dental education, where we use this mannequin and it gives a 360-degree view on reconstructive aesthetic procedures so that the students get immediate feedback on what they need to do. And the patients also can get a feedback on what they will look like after treatment using augmented reality. So, augmented reality, and when we talk about augmented reality, the next thing is virtual reality. And virtual reality is also coming into a big play in dentistry. Dental surgeons are now using virtual reality goggles to actually operate, and medical students from other places can see this using the virtual reality goggles as well. So you can operate and teach from remote locations. So these are all the latest advances. Now, are these advances going to help us, or is it going to make our teachers lose their jobs or dental technicians lose their jobs? Until now, we've had dentists who communicate with patients directly. All our clinics are full, but after COVID, we've moved into teledentistry, and where people living, the benefit is people living in rural areas can go and see their dentists online, and you can actually give your advice online, and you don't actually have to go and see the patient. But again, is it good or is it bad? Does it remove away the personal touch that the dentist has with his patients? These are points to ponder. I'm probably playing the devil's advocate today by talking both good and bad about advances. When I started, I told you about processes that can be made in 1 hour. Now, traditionally, when a patient needs a crown, the dentist must make a mold of the tooth, he must fashion a temporary crown, and he must wait for the laboratory technician to make a permanent one. But now we have the CAD, we have the 3D printer. Even MAHSA University is using a 3D printer where you drill the tooth, prepare it for the crown, take a picture with a computer, the image goes to a machine, and that machine makes the crown right in the office. So 3D printer does the work of a dental lab technician within a few minutes, which otherwise would have taken us several days of manual modeling, which again is technology for us. But at what cost would this technology help us improve, or would it cause us to lose our jobs? So I won't take much time, but there are a couple of more technologies I thought I'd share with you. One more is the intraoral camera. We now have in dentist chairs, dentists actually try to view the teeth, but not always can you view the teeth properly. How much ever wide you open your mouth, there's always some inconvenience. So now we have something called the intraoral camera, which works as efficiently as the human eye. So you can actually see clearly instead of trying to peer in through a partially open mouth or in an inconvenient way. Now, these are all new technologies again. And before I finish, there are some universities, Nottingham and Harvard, where they believe in regenerative dentistry. Now, regenerative dentistry is where the university, the dentist, regenerative dentistry is where they develop dental fillings which put into the teeth, allow the teeth to heal themselves. In other words, stem cells are put into the fillings, and these stem cells will allow the teeth to heal themselves. So these are all the latest forms of innovations that we have in dentistry, and these innovations are here to help us. And at the same time, we know that probably some of the jobs may be redundant, but in terms of recent advances, we hope that all this helps the dentists, and we hope that all this are important topics of discussions that can be discussed today and in the next few conferences as well. The future is bright for dentists and dental education, and I wish the conference all the best and all the participants to have a wonderful time today. Thank you very much and have a nice day.
Thank you so much, Prof. Sri, for the beautiful insight given. We would want all participants to have a fruitful session at the end of this 2 days conference. We hope that everyone will have a good knowledge gained by this conference. We shall take a short break before we start our next lecture. Thank you so much.